We are really excited to have you join us again for these courage sessions. As we've mentioned, these are opportunities for all of our member institutions with TMDSAS to come and answer your questions that you may have about the cycle. This is a weird year with COVID-19 affecting every single aspect, not just of the application process, but the overall preparation process. We're really excited to have the Texas Tech University Health Sciences Center at El Paso, Paul Foster School of Medicine admissions team here with Dr. Perry and Ms. Galindo. Would you two mind introducing yourselves?
Absolutely. Again, I'm Cynthia Perry. I'm the Assistant Dean of Admissions and also Assistant Professor in the Department of Medical Education. I teach our first and second year medical students molecular pathology, biochemistry, and microbiology. And I'm very happy to be joining you guys today.
Thank you.
Hey everyone, I'm Monica Galindo. I am the Assistant Director of Advising and Recruiting for the Foster School of Medicine. So I do all the advising, anything coming from since high school all the way to college, and I also do a lot of the recruitment. So some of you might already see me at your recruitment fairs in your cities at your schools. So that's kind of what I do, and a little bit of everything else. So it's nice to have you here, and hopefully you'll get good information out of our session.
I'm sure they will. Before we kind of kick in
to
learning more about how COVID-19 has affected this application cycle, would you mind, Dr. Perry, giving us kind of a quick history of the Paul Foster School of Medicine?
Sure, absolutely. So we, for a long time, we're kind of considered the new kids on the block in the state of Texas. And we're not the newest school anymore. So we've definitely grown out of that. In fact, last year, we actually celebrated our 10-year anniversary as a school of medicine. But we actually have a very long history prior to that. So we have been actually training medical students in the city of El Paso since the 70s. So we have a very long history of being an academic medical center. We were established originally in 1969 as a branch of the Texas Tech Health Sciences Center in Lubbock. And for a long time, we're training third and fourth year medical students. So we've had faculty, we have a training center, training hospitals, teaching hospitals. And so at some point, we decided that it was time for far West Texas to establish itself with its own medical school. And the reality is that the city of El Paso, even now, we are only about 50% of what the nation is as far as physicians per capita. And so we're at about 100 physicians per 100,000 residents. I think the national average is about 200 physicians per 100,000 residents. And so we're definitely behind the curve, and recognizing that, we definitely saw the need to train physicians in our region, train physicians that were going to be experienced in what the needs were of our border community. And because of that, those were some of the big reasons that propelled us to develop our own freestanding four-year medical school. And so we sat our first class in 2009, and actually in 2013 became an independent institution. We now have a graduate school, besides the medical school, a nursing school, and we'll be seating our first dental students this cycle as well. So we're definitely growing as a health science center, and have now sat 11 classes in our school of medicine. So.
Thank you so much for that. And for those of you that did watch the previous session with the Woody L. Hunt School of Medicine, School of Dental Medicine, you know that I will try really hard to avoid talking about how much I love El Paso and the food and the people. It's going to be very difficult for me. I'm very biased. I grew up there. But would you mind kind of going through how the community in El Paso really comes into play with the medical school setting?
Sure, absolutely. I don't know if Monica, you want to start off. Monica's been in El Paso for a long time too. She may want to talk a little bit about what our school means to the community.
Yeah, so as Dr. Perry mentioned, although El Paso or Foster or Texas Tech Health Science Center has been in El Paso since the 70s, opening up that school, has really helped out that community. So I have been in El Paso for at least a little bit over 10 years now. And the type of people or the type of community that we have, majority of them are Spanish speaking, especially being, at the border and everything. We do get a lot of patients, not just from the area and the surrounding areas as well. So the type of community, that we have that plays into the Foster School of Medicine is that those of underrepresented, underserved. So the type of students that we look for, or, that we really know that will thrive in this type of environment are those type of students that are looking for, to serve these type of populations. So those that are compassionate, caring, those are the type of physicians that we want to, get from our medical school. Obviously, the medical school will give you the knowledge and everything in medicine, but in terms of the community, Foster School of Medicine does give a lot back to the community. So if you're very, if that's the type of physician or philosophy that you have in terms of giving back, Foster School of Medicine is very giving back to the community. We have different student-run clinics where it's free for the community for them to come out, and it gives the students practice as well. And then there's also a lot of events that the students get that they come together to do for the community as well. And even the own Texas Tech, like they'll have in the winter, like community events for students to come. Our admissions office actually has outreach programs too that help the community in terms of being exposed to healthcare and activities that students can come and so we're very, very involved with the community, very open with them. So it's very involved.
Yeah, they're integrated fully. You brought up an interesting point about the Hispanic population in El Paso. And I know that one of the major misconceptions about applicants, the applicants have about El Paso is that to apply to the medical school, you have to speak Spanish. Would you mind addressing that myth?
Sure. Yeah, so we, and I think that misconception comes from the fact that we were the first school in the nation to actually have Spanish as a required part of our curriculum. We saw that as a really pressing need because of the types of physicians that we were looking to train. Obviously, we were the first school to be established on the US-Mexico border. And with the expansion of Spanish-speaking population across the nation, we felt like it was really important to emphasize cultural competence as part of our curriculum. And so one of the ways that we do that is by ensuring that we're training physicians that are able to communicate appropriately with their patients. And so we certainly don't expect our students to come in knowing Spanish, but we do want to make sure that all of the applicants know that they will be learning Spanish and that they understand why. They understand the importance of that and that they buy into that philosophy, because for us, cultural competency is very important, not just because of where we're located or the patients that they'll see during medical school, but for their future practice. And so certainly there's no advantage or disadvantage for students as far as admissions goes. I'm sure once students come to us and start their coursework, it makes it a little bit easier for that transition to start the Spanish curriculum if they have some background, but we don't look at that in the screening process for admissions.
It's helpful to know. Now, for anybody who's really keen on actually going to Paul Foster School of Medicine, is there anything in their application that makes them stand out that really kind of sets them apart as somebody who really fits the mission of the school?
Sure, I can start and then I'm sure Monica can add to that. One of the things that she touched on earlier is that community engagement. Certainly because of the level of outreach that we do in our program as an institution, and the fact that we really want to be known as a resource for the border community. We look for that in our students. We look for that in our applicants. So we're looking for students that have a record of service. We want to make sure that students appreciate that they're going into a career that is service oriented. Yes, it's a profession, and yes, it comes with a lot of recognition, but at the end of the day, it's about caring for others. It's about that compassion and being able to bring yourself to give of what you can. And so we're looking for those traits in students, and how have they demonstrated that in giving back to their community and engaging with their community. And so that's something we certainly look for and emphasize in our recruitment process. And Monica, did you want to add to that?
Yeah, so I was going to say other things that we look for. So we want to see what you're coming in with in terms of uniqueness as well, like in terms of the type of meaningful activities that you're doing. So I know a lot of students believe like, oh, I have to do research, I have to do scribing or shadowing, thinking that, you know, this is, since all medical schools take it, or a lot of students are doing it, that they believe, you know, it's kind of like a checklist that they have to do. But really, what really sets a student apart when we're, you know, looking at applications is really that meaningfulness that they bring, that uniqueness in terms of activities that they do. So for example, if you enjoy working with, you know, children, you know, there's always so many camps, so many different activities that you can do with children. Or if you like, you know, let's say you're interested in helping those, again, going back to the underserved, there's a lot of students that do, you know, hospice volunteering, or homeless, working with homeless people or population. It's just, we want to see what your passion is through your activities as well. So going back to what Dr. Perry said about being very service oriented, because that's a big mission of our school. That's how we see the type of also activities that you're doing, that they're meaningful to you, and you're also giving back. So it kind of is a 2-for-1, and it really shows. It stands out really when you talk to these students, because they're able to really, you can see the passion that they have in the meaningful activities that they do. So that really does also set them apart as well.
And on the advising end, you know, this is one of the reasons why advisors really emphasize keeping a journal while students are doing activities, so they can really reflect on the different experiences that they're facing. You know, think about how they might be able to face challenges, identify any areas for improvement. And so there's just so many benefits to having that opportunity to reflect. And clearly hearing you all now talking about how important that is in the application, I think should really highlight that that idea that a lot of our advisors are sharing. So this is a live Q&A. So if you have any questions for the Foster School of Medicine, please don't hesitate to share your questions on here. Of course, we have some questions prepared based off of what we've been hearing from several applicants, but this is your time right now to ask anything and everything that you'd like to know about the Foster School of Medicine. I know that the curriculum was actually something that, when it was implemented at Paula Foster, was something that was revolutionary in the state of Texas. Would you mind kind of walking us through what the curriculum looks like at the school right now?
Absolutely. So I think one of the things that we're most proud of at Foster is our curriculum and the innovation of our educational approach. We were the first school in the nation to adopt what's called a clinical presentation-based integrated curriculum that was modeled heavily after the University of Calgary School of Medicine curriculum. And so it was brought down from Canada, we brought it to the States. And our thought process with choosing that to model our undergraduate medical education after was that we wanted to be graduating physicians, graduating trainees that think like clinicians do, that think like practicing physicians. And so it made sense to us to be training students to think in a certain way. And the idea behind that is that when we surveyed hundreds of physicians, one of the themes that stands out is the way that they think. There's this unconscious process in how they go about breaking down or coming to a diagnosis. And that process really revolves around this idea of a scheme. There's, depending on what the clinical presentation of a certain patient is, and that could be really any of the main reasons that you would go to see your physician. So Enrique, you don't go to your physician and say, I have such and such disorder. You say, I have a fever, or my throat is sore, or I have a cough. And so that's how we teach our trainees. We teach our students to how to think about a patient that's going to come to them with a particular symptom, and then what does that diagnostic tree or diagnostic reasoning process look like? And the most experienced physicians go through this without really recognizing that they're going through this thought process, right? But we actually break it down for our students to think about the different diagnostic branch points, and then throughout the week we talk about all of the basic science concepts behind each of those decision-making points. So what relevant anatomy do they need to know? What's the relevant biochemistry or immunology? That's how we teach those concepts. So we don't have a pathology course or histology course, like kind of the traditional approach to. It's a little bit different. And it certainly takes our students a little bit of a transition period to get used to that approach. Medical students are inquisitive by nature, and they want to know everything up front. And so when you talk about a certain concept, they want to know all the details right away. And our curriculum, it'll present a concept and then we build upon it across the following 18 months. And so it's a little bit different for students up front to accept that and understand how to approach that and how to study for our type of curriculum. But at the end of the day, what we see is that students enter into their clerkships with a better ability to work up a patient and a better ability to be able to apply basic science concepts to clinical reasoning. So we're really proud of our curriculum. And I think one of the things that stands out about being a newer school is that we're not set in our ways. We take a lot of feedback. We're continuously seeking out ways to improve, to change our curriculum, to change our educational model. And it's all for the betterment of our students. So it's a very fluid process for us.
Awesome, thank you for that. And how has the feedback from students been as they've graduated and moved on to the residency and now are practicing physicians?
Sure. So we, one of the things I think that's also really unique about our educational approach is that our students are actually working with patients. I can't say from day one, it's actually before fall classes start their first year, because we do what's called a summer immersion. And so we actually bring our students in for 4 weeks before the fall semester starts, our incoming class. And during that immersion period, our students are actually out in the community. They're starting their Spanish curriculum, but they're also starting to see their future patients. And that continues into the fall semester of the very first year. Our students are working, starting off with standardized patients in the stimulation center, and then working out in the community in the free clinics like Monica mentioned. So our students get very, very early clinical experience. And because of that, again, when they start their clerkships, they don't have that transition period that some students have in a more traditional 2-and-2 format. Our students are used to working with patients. They've gotten over that fear of being at the bedside and taking history and physical. And so our students have that comfort. And so they're really able to just jump into their clerkships, start working with patients, presenting patients right away. And that transitions, of course, to residency as well, where our students are really well prepared and feel very comfortable presenting patients and really acting as leaders in their fields.
Awesome, thank you. We have some questions here that I want to make sure that we get to. The first question is about the secondary application. Could you walk us through that process for Foster School of Medicine, and then maybe offer us the adjusted preferred timeline for when those secondary applications might be submitted this cycle?
Sure. Did you want to talk a little bit about this, Monica, since she's advising our students every day?
Yeah, so for the secondary applications, basically once we receive your primary, we send out, the secondaries, and then once we receive the secondaries, then sometimes the application will be complete or not. It just depends. I always tell students that just because they submit their primary, it doesn't mean their application is complete. We do need the secondary. We need their letter of recommendation as well. Their MCAT score, and especially right now with COVID and everything happened, I know that's probably one of the biggest things that's holding students back, the MCAT score, since everything was pushed back. But so my biggest advice in that sense is to try and submit, your primary and your secondary as soon as you get it. And then we basically would just have to wait for your MCAT score to come in, but at least everything has been processed already and is just kind of waiting there until we get that score. So in terms of timeline, I know this cycle is different. So, and I know, the application deadline was pushed back, but my biggest advice is the sooner the better, still the same as every year. On any other regular year, it would really be trying getting everything in before August. That's usually, I tell the students, anytime from June, July, that's a good time frame. But right now I know because of everything that's happening, we're trying to be flexible. I know everyone's, a little all over the place, but biggest advice still would be to try and submit everything as soon as possible. If your MCAT is the last thing that we're missing, I rather you have in your letters of recommendation the primary and the secondary already submitted and just waiting for the the MCAT to come in. So still same advice as every year, try and get it as soon as possible. So.
And our timeline did change a little bit, just to adjust to the new TMDSAS timeline. So as with the primary application and all of the other deadlines, we also did push our deadline back. And so what would normally, our secondary would normally be due in November, we did adjust that to a December 1 deadline for our secondary application. And that includes having a secondary completed and the secondary fee paid. Again, just to emphasize, we won't be able to screen an application until it's considered complete in our system. And that means the secondary is submitted and the secondary fee is paid. So just a reminder, December 1 is that deadline, and we will be interviewing through the middle of February this cycle. So again, everything's pushed back about 30 days.
And what about for students who had their MCAT delayed significantly this cycle? What advice do you have for them in terms of how the review process is going to look like?
Sure. So yeah, we're definitely cognizant of all of the delays and the challenges that students have experienced. Because of that, we did open up a number of additional interview dates later in the cycle. And so we do anticipate, still being able to invite and interview the same number of target students that we do in a typical cycle. Because we have delayed all of our timelines, we do anticipate that we will be able to get everybody screened and evaluated, including their MCAT scores being received while we're still in the interview process.
Great, thank you. We have a question about the Casper, because you all are one of the schools that actually uses Casper, and we've talked about this several times with some of the other schools that use Casper, but would you mind kind of giving us a clue into how Foster School of Medicine uses Casper in the evaluation of an application?
Sure. So this will be our second cycle requiring it. We have received scores for 3 years. This will be just the second year where we actually required it as part of the application. And we use it as part of the holistic review process. So we're looking at students from every angle, not just their academics, not just MCAT scores. We're looking at all of that qualitative information that we're getting about students as well. And so for us, the Casper is just one additional thing that helps us to look at a student from every different perspective. And it's just one more data point that we can use to evaluate students. So we don't use it in any kind of algorithm. We're not using it as a cutoff. And so we're certainly not using it to include or exclude any students based off of Casper performance, but rather just as another aspect of a student's application package.
And so not having a Casper would keep somebody from getting an interview, correct?
That's correct. Yeah. So again, as with the second year application, having the Casper score is something that is required for an interview. Now, we will review the application without the score, but we do require their date, or we do require them to be registered for an assessment. So we're able to see when students are registered for their Casper tests, and we will not extend an invitation to interview if we don't anticipate receiving the Casper score by the time of the interview.
Got it. Thank you. We have another student asking, are there any opportunities for undergrad students at Foster to help us prepare for applications or start getting experience, volunteer, or opportunities to shadow?
Absolutely. This is Monica's realm if you want to jump in on that.
Yeah, so in terms of having, I guess, experience or to be able to get with the Foster School of Medicine, this goes a lot with the outreach and stuff. So I know with the graduate school, there is a SABRE program that, you know, a lot of students, if they're interested in research, this is a good opportunity for them to hop on. And that obviously, you know, gives them also that experience for research and how to do research and such. In terms of, I guess, is the question asking like stuff to do at Foster or just things overall that they could be doing? Did it just say like overall?
I think the question is specific to Foster, but I think we'd always cover more of what students should be doing.
Okay, yeah. So other things also, for at least like at Foster, I know we also have a summer enrichment for undergrads as well. That would actually go through Mr. Renee Andre. He's our outreach liaison person. But also, you know, or I guess activities or programs come up every year. And so I always tell students I'm one of their biggest resources that they can use. So if they ever have any questions, and they can always contact me. And you know, we're kind of starting to develop a listserv where when there's opportunities that come up with Foster or anything like that, we can send them out so they can, you know, get that experience. And I know sometimes it is hard, especially if they live like in rural areas, to get any type of experience. I think with COVID right now, virtual programs have become really big. So who knows, maybe in the future, because we know El Paso is pretty far from all the bigger cities, for them to come and, you know, stay here for some time for any type of program, you know, we might start developing virtual programs where, you know, they'll still be able to attend and get some experience of some sort. So I guess this is something good that COVID has brought on to us about, you know, being able to expand to more students in terms of having virtual programs and such. So yeah, so that's kind of, you know, there's not really like big I guess programs or events currently that we have. We're trying to expand, like, you know, we've been open for 10 years, and although it's been some time, you know, we're still slowly, you know, growing and developing. So contacting me would probably be the best thing for me to, find out for programs and help out to give ideas and such for what they can be doing.
And to add to the suspense, we won't ask for how to contact you until the end of the session.
Okay, yeah.
All right, there's a kind of jumping back to the MCAT discussion. For applicants who are retaking the MCAT, how does that come into play in the review process? Because they already have an MCAT score, and so technically they have a complete application, but they may not be happy with that initial score. So how does that come into play this cycle?
So specifically reapplicants or students that are retesting?
I think it just includes everybody who's retesting.
Okay. Yeah. So certainly if we see that students have a pending MCAT score, we will go ahead and wait for that to be released before we complete the review of the application. If there is a current MCAT score in their profile, we may go ahead and screen it, but we won't submit it or save it until that pending score has been submitted to us. So we certainly want to make sure that we're giving students every opportunity to demonstrate the best of their abilities. And so if students are planning on retaking the MCAT this cycle, but have a later test date, then we will wait until we receive that score.
Thank you. And we have a group of questions kind of coming back to the discussion about the curriculum. So these are going to be kind of all over the place. The first one is asking you if you could share some of the research opportunities for medical students available at Paso.
Yeah. So one of the things that's in addition to requiring Spanish is that we actually do require our medical students all to complete a research project. That's called our SARP program. It's a scholarly activity and research program. And it's a very flexible requirement. It is a graduation requirement. So to complete that, students have to commit to a minimum of 10 weeks of research. They identify a research mentor. That can be on campus, it can be with a clinician, it can be in our basic sciences graduate school. It can also be off campus. So we have students that choose to go and do summer research programs or work with previous research mentors and return home for the summer to do a research project. Now that requirement is very flexible because we understand all students don't want to necessarily do bench or translational research. The idea is we want students to develop inquiry-based reasoning. And so we want students to work on their skills at networking, identifying a research mentor, working with faculty, but also identifying gaps in primary literature and put together a research plan. And so whether or not they come out of it with a manuscript or they come out of it with some amazing, findings isn't necessarily our goal. The goal is really that learning process in developing a research project, because we think that developing that thought process as a learner is really important. So we have students that'll do research in public health. We have students that'll do research in even in medical education, educational theory, of course, basic science, clinical research. So it's very flexible. We want to make sure that students have the opportunity to do research in a field that excites them. And either they know that they love working in, or maybe they want to explore a little bit more. So certainly we emphasize research. It's not required to apply. But we want to make sure all of our students graduate with an understanding of how to approach a research project.
Great. And our next question is on, let's see, if today's medical spectrum has had any impact on Foster School of Medicine's epidemiological views, would it be helpful for an applicant to be involved with contact tracing or anything like that?
All right, so what I will say is that we're definitely, given our location, we have a really unique opportunity to do public health and epidemiology type research in our region. Because of that, we actually do offer, just as a side note, we do offer a joint MD-MPH degree program. Just because El Paso being right on the border, I literally can look out my office window and look at the border, look at our sister city of Juarez. And it just offers our students a really unique opportunity to study those social determinants of health and the impact of that on our patients and on their future patients. With that being said, I think that any unique things that students are being involved in right now that are going to set them apart in an application is always a fantastic thing to do. So if they're involved in COVID related research or involved in contact tracing projects, it certainly would look great for them. But I will say, only if it makes sense in the context of their application, right? So, and this goes with any activity. We don't look for students just to be checking off boxes of certain types of activities. We want to see some kind of theme, and Monica touched on this. We like to see a story on an applicant. We want to understand what it is that they're passionate about. And so it wouldn't make sense if there was a student that was really focused on other kinds of activities and then all of a sudden jumped on doing maybe some research, just for a couple months in the context of a complete application. So we really look for that whole picture so that we can see what their story is.
And the last question that was a follow-up to the curriculum is, you've referred to how Spanish is integrated into the curriculum. Could you give us some examples of how that is?
Absolutely. So students are going to, like I mentioned, they're going to start their Spanish curriculum in immersion, in summer immersion. But that's going to continue throughout their 4 years. I mentioned that we're right on the border. The fact is that a majority of the patients that our students are going to see are going to be Spanish speakers. And so not only are they going to have the opportunity to practice that on a daily basis when they're in their clerkships, but also a lot of our students volunteer in our student-run free clinic that's in a very rural area of Sparks. And majority of those patients there are Spanish speaking. We also, as an institution, sponsor another free clinic that is focused on providing services to migrant farm workers. And then that curriculum itself, that curricular thread, runs through the entire 4 years. So students will continuously be revisiting and reemphasizing their Spanish learning and their Spanish language development. And so it's something that is continuous. We have developed a lot of additional asynchronous ways for students to continue to practice their language development, on their handheld devices, at home, and then in small group learning as well. So lots of different ways that we incorporate that.
Great, thank you. And Monica, this one might be for you. It's about the summer immersion program. Is there an advantage in the application if you have previous clinical experience?
Like we've been mentioning about the whole uniqueness. Yeah, if they have clinical experience, that's always great. Obviously, well, when I'm advising students, I always tell them that, community service is just as important as healthcare. A lot of the times, we get students that, they don't do as much community service as they think they should. So they have a lot of healthcare, or vice versa. But both, going back to, students have probably always heard about how we look at the application in a holistic approach. That means we will look at everything. So it's kind of like a balance of everything and looking at your story. So if you're doing the clinical, if you're having clinical experience, it's because, that's something that you're looking at, you're interested in. And obviously, going into physician, there's a lot of clinical hours and stuff like that. So that's kind of something that we do want to see, because we want to know if you know what it takes to, you know, be a physician, what the environment is like, how they talk to patients. But really the biggest thing that in terms of clinical experience that I always tell students is trying to find that patient interaction with them, or trying to find patient interaction. And that's I feel like that's something that really will make their experience meaningful, because they'll be able to tell a story of how either a patient impacted them or they were impacted by that patient. And you know, it's always good to have that network and that connection. And I always tell the students, once they have those meaningful experiences, if they ever get invited to interviews, that's like the greatest opportunity for them to be able to really show their passion about why they want to do medicine. You know, they really have you know, a foot on saying like, this is exactly what I want to do. So yes, in terms of clinical, you know, experience, we do encourage that, obviously, because you're going to get so much learning and knowledge from having that. So
let's see, could you tell us how the admissions committee might look at somebody who has multiple MCAT scores?
Absolutely. So we, in our screening process, when we're doing the evaluation, we do look at just the highest score for determining eligibility for an interview. And that will utilize the highest score for determining rank after a student has been invited for an interview. Now, the committee, we are an open package program, in that interviewers and our committee do see a student's complete package. And I mention that because there are some schools or some programs that do have a closed process where the committee and the interviewers don't see that information. And so the committee will see any previous MCAT scores. Some of the things that we may discuss is if there's been an upward trend, what kind of progress has been made, and if there's been challenges along the way that may have hindered improvement, we'll discuss that. But obviously we understand that life happens. And so sometimes students may have family sickness or illness that may have posed a challenge to a particular studying process in a past year. Or one of the things that we really like to see, and we do talk about in some depth with applicant or in regards to an applicant, is what changes have they made? Because for us, that shows us what kind of self-reflection process the candidate has. Were they able to think about their own study skills and what was working and not working, and make the appropriate changes to help improve their scores? And maybe it's their test taking skills. Because for us, those things are really reflective of how they're going to perform as a medical student. We think of our medical students as lifelong learners. And so we want to bring in students that are able to think about how their study process works and what works and how they may have to adapt. One of the things that we see a lot with incoming first-year students that have academic challenges is they are resistant to change. And even in the face of a completely new curriculum and a completely new way of learning and amount of information, they still think that the same old ways are going to work for them. So we really actually like to see students that may have had some kind of challenge, but learned from that and improved. And so having multiple MCAT scores isn't a negative, especially if it shows to us that you have shown improvement and learned from the process.
Having that growth mindset really goes a long way.
Absolutely.
So let's see, one more question and then we'll get to the big one, which I'm sure is going to be the interviews discussion. So for applicants who've already submitted their application on TMDSAS, they're not able to update their activity section. So for those that have new activities, how do you suggest they communicate those to the school?
Sure. So we don't take updates or letters of intent. Any information that goes into an applicant's file does have to be submitted through TMDSAS according to the timelines and guidelines that have been set. So we don't have a mechanism for adding additional information to an applicant's package. Now, what I recommend is that students wait to hear about interviews and bring that information to their interviews. That's really the perfect time to talk about what they've been doing in the meantime. Students are really overwhelmed with the current environment that we're in, and understandably so. But this has been a process that all of our pre-med students have been preparing for years and years. And so hopefully the track record that students have set for themselves with previous activities and their previous academic record will carry them forward, get them that interview, and then they'll have the opportunity at that time to talk about what new activities they've been involved in. And so that's really what we emphasize. And, you know, certainly some students that don't get an interview, what I would recommend is meeting with an advisor like Monica and reflecting on their application and where they may have had challenges, or they may be perceived as having gaps or weaknesses as an applicant. And my suspicion is that it's not going to just be within the period that we've been affected by the COVID-19 epidemic. It'll probably be something that they haven't done in the past, right? So we're always looking for longitudinal activities, things that students have been doing for a long time and really established themselves in. And so any new things are great, but again, we're evaluating students based on their complete package, what they've done in the past 3, 5, or more years for non-traditional students. So.
Excellent. So that leads us right into the elephant in the room on how interview questions or interviews just themselves are going to be conducted this year.
So absolutely. We're just as nervous as the students are. It's going to be a new experience for us. Certainly, you know, we're a little disappointed because El Paso is far from a lot of places in the state of Texas. And El Paso, as the name implies, is a place that people drive through, but don't always stop and visit. And so for us, it's a little bit nerve-wracking to know that the majority of our students aren't going to have the opportunity to come and spend time with us on our campus and in our city. With that being said, we're going to be doing 99%, if not all, of our interviews virtually. And so our interview days are going to look a little bit different, but have a very similar feel and schedule to them as we have in the past. We're going to have a morning that's going to be very informative, talking about our campus, talking about our curricular program, the student experience. We want to make sure we're providing as much information as we can in that morning program. And so we'll have virtual tours and student panels and a lot of opportunities for students to get all their questions answered. And then we'll have virtual interviews, and we'll continue with our process of each student having 2 interviews, and those will be held in the afternoon. And so it'll be a new experience for us. We are going to be working with our application management program and their virtual interview module, which is built around Zoom. And so interview invitations will go out, and then the informational links will follow that. And so it'll be a learning curve for us a little bit at the beginning, but hopefully we'll, fingers crossed, have a flawless transition. So
awesome, thank you. And what advice do you have for students who are preparing not just for the interviews, but for virtual interviews?
Yeah, so I think we've all had to learn a lot about how to best handle this. And from a teaching perspective, I know there's been a lot for us to learn as faculty, and our learners have actually probably been the best teachers for us with their knowledge and savviness. But I would just say, obviously, prepare ahead like you would for any other interview. Find somewhere with great lighting, and practice again like you would practice in front of the computer. It's a little bit different. We always tell students, if you can't find someone to do a mock interview with, practice in front of the mirror. But I think practicing with a peer, whether they be in the same household or not, and actually doing some virtual chats, doing some virtual mock interviews is really good, because a lot of students haven't had the opportunity to do that. When we do all of our workshops and work with pre-med organizations, we do a lot of in-person mock interviews, but students haven't had the chance to do mock virtual interviews. So again, it's a little bit different in learning how to develop that connection and rapport. So I would encourage students to practice that, and try out different places, different lighting, different seating, and see what comes across and ask for feedback.
I actually also wanted to add something for that in terms of more of hardware. If your internet, try to find the best place for the internet. Ethernet cords will go a long way. So, connecting straight in, that's going to help a lot. Also, if you guys want to buy or have like noise canceling headphones too, like for example, me, I have dogs in the house and I had to put them outside because they, they'll be barking during this, but, trying to get those distractions out as well. So my point is more of the hardware kind of, part, but yeah, also, practicing, seeing where is the best place and all that, that's gonna go a long way. This way your interview at least goes flawless in terms of like no connection problem or audio problems or anything like that.
You just addressed one of the questions that came up. Would it be appropriate to wear headphones? And I think it might even be recommended just to block out some of the ambient noise that might be going on. Will the virtual interview format alter the number of candidates you interview?
We're hoping not. It may. The beginning of the cycle, we're looking to interview slightly less than normal, just for our own transition and learning process. But because we have the additional dates with the extension of the season, we anticipate still being able to hit our target number. So WMC recommends interviewing at about a 5-to-1 ratio per seat. And we usually are well above that. And so we're hoping to be able to interview just as many as we have in the past.
We heard the collective sigh of relief among all of the applicants across the state. There's a follow-up question to, I believe this might go back to kind of the curriculum domain. The student is asking about the anatomy and research distinction programs at Paul Foster, and they want to know, one, if there is a primary care emphasis on either one of those, and secondly, if students can participate in 2 programs simultaneously.
All right, someone's done their homework. So yes, we have a distinction in anatomy program. In that program, students actually will spend a summer between their first and second years doing full body dissections for the entire summer in preparation for the incoming class, helping to prepare pro sections for our anatomy labs. And then they'll also serve as TAs. They're also expected to do an advanced anatomy elective in their 3rd or 4th year. Our distinction in research and scholarship is application-based, essentially students in their third year, once they've completed their required research project, and many students will actually do multiple research projects as students, they'll apply for that distinction program. So absolutely, students are eligible to do multiple, have multiple distinctions. We're on the horizon. We're looking to develop additional distinction type programs as well, so that students have more opportunity to have kind of specialized experiences or more personalized experiences in their medical education. As far as primary care goes, we also have a Scholars in Primary Care program. And with that program, students are very actively engaged in our student-run free clinics, and also in our a migrant farm worker clinic that we run. And the primary care, the Scholars in Primary Care students also are funded to go to national conferences in primary care as well.
Awesome, lots of great opportunities. All right, we have a group of reapplicants here, have a few questions, and they've all upvoted each other to make sure that we ask this. For reapplicants, are they flagged in any way by the review committee, and you know, what do you look for in reapplicants?
Sure. Do you want to talk about this a little, Monica, and then I can add my 2 cents?
Yeah, chime in. Yeah. Okay. So I think Dr. Perry already mentioned about the self-reflection and how we like that growth. So it's the same for reapplicants. We want to see what it is that you've done to strengthen your application. So going back to, like, for example, application reviews, if it didn't work out the first time, you get application reviews. There's even a question on the TMDS SAS application that states, like, what have you done to strengthen your application? You know, that really gives them that opportunity to really see, you know, did I look at my application? Did I see what it is that I'm missing? Maybe it's my, you know, maybe it's my essays, maybe it's I need a little bit more community service or more meaningful experience. So they aren't flagged. Personally, me and actually Paul Foster School of Medicine, we really like non-traditional reapplicant students, just because they have learned a lot from, like, their initial application, and they are still, it shows that I guess grit, that they're still continuing on their journey, and they're going to do anything possible to still get there. So personally, I actually really enjoy talking to those students, because you can really see that passion that they have, and they tell me, you know, I'm going to do whatever it takes to, you know, get into a medical school or to get my journey of becoming a physician. So we actually like reapplicants, especially those that, you know, are willing to do anything, and that they will you know, sit down and reflect on what it is that they need to do, whatever challenge it is that they have to. A lot of the times it could be the MCAT score, you know, and you know, this is really, again, going back to what Dr. Perry said about the MCAT score, we really get to see what it is that they changed or done to become a better applicant overall. So no, they're not flagged or anything like that. What we really want to see is what they have done, you know, to prepare and become competitive applicants. So.
All right, I think that's covered.
I think so too, and we've got some great feedback from a lot of reapplicants out there. You'll keep going at it, because if this is the journey for you, that resilience is really going to be key in your application. The last question we have has to do with gap years. How does a gap year kind of come into play in a review of an application? And you just mentioned non-traditional students. A lot of them will take, you know, maybe, and I don't like calling them gap years. I like the term that Dr. Jones had coined, which is an enrichment year. And so could you kind of talk to those students who are looking at taking an enrichment year, and how a school might look at their application?
Absolutely. I think one of the smartest things that students can do is be realistic with themselves in their process. And so if a student has decided that they want that time to develop themselves as a competitive applicant, then by all means, they should absolutely do that. And for us, as an Office of Admissions, and I'm speaking for the committee, we really appreciate when students do that. It shows a level of maturity and self-reflection that we're looking for in an applicant. There's so many different ways that students can use that time. And we certainly are looking to see how they've used it constructively to fill any identified weaknesses or gaps that they may have. I think one of the biggest mistakes that students can do is to not be upfront about it. We look at the timelines, and so if a student is going to have an enrichment year after graduation, it's a mistake to not address it and not discuss how that came to be and what your plans are for that time. Because I can guarantee that if you get invited for an interview, that'll be one of the first questions that you'll be asked. Is how did that come to be? And it's okay. It really is okay if you maybe made the decision late to pursue this career path, or realize that there was some self-development that you needed to do. But again, it's best to address that up front and then discuss what you're going to do with that time.
Excellent. Well, we've reached the end of our Courage session, but and thank you both so much for taking the time to address these questions. I know we've hit quite a variety of topics, and before we let you go, I do want to offer you an opportunity to address all of our applicants right now, maybe offer some words of encouragement as we face this very odd year.
Absolutely. Thank you for having us, and we hope that you learned a little bit more than you already knew about foster school medicine. We hope that it encouraged you and sparked some interest in hopefully visiting the city of El Paso and coming to see what we have to offer as far as our culture and as far as our institution. And I definitely want to encourage everyone to continue pursuing this career path. And please absolutely reach out to us. We all field inquiries and requests for consults and advising and mentorship on a daily basis. And this is really what we're here for, and what everyone in our office is passionate about doing. So best of luck to everyone in their pursuit of medical school, and we hope to see you on campus in the future.
Thank you. And then Monica, if you wouldn't mind.
Well, I just wanted to say, yeah. So yeah, thank you again, for having us. This was wonderful. I hope, the students were able to get more information. Again, being that El Paso is so far away, we know sometimes it's hard for them to even have any interest at first, but El Paso is growing. It's growing a lot, and it's a great opportunity to, to get your medical education here. And so in terms of like advising and tours and all that, I'm the person for that. So again, like I've said already, use me as a resource. That's what I get paid to do, you guys. So don't be afraid to contact me. I don't know where we can put my contact information or anything like that, but I mean, if you always go onto the website, you'll find me on there, and I can always help you, for mentorship, guidance. If you guys are, just passing by, you're going to Disneyland or something, and you want to make a pit stop in El Paso, you can always come and we can give you like a quick tour, just meet, the Office of Admissions. But like Dr. Perry said, yeah, we're all here to help you guys out in any way, shape, or form. So, and if we don't know the answers, we'll always find a way to help you guys out anyway. So yeah, thank you.
Yeah, and you said it's an email address that folks can reach you at. Would you mind sharing that?
Yes.
All
yes.
right.
So it's do I type it down somewhere, or do I just say it here?
You just say it here.
Okay. So it's Monica .Galindo at ttuhsc.edu. But like I mentioned, if you go onto the website too, like it says for any appointment, I think my email's like right there in the middle, kind of with everything that's going on. So any questions or anything like that, I'm pretty good at answering my emails back. So I hope to hear from you guys.
Excellent. Well, again, thank you both so much for taking the time to answer these questions. And on behalf of TMDSAS and the Texas Health Education Service and the Foster School of Medicine, we'd like to wish all of our applicants all the best of luck. Keep at it, and we'll see you next time.